The most prevalent modifiable risk factor for cardiovascular disease is high blood pressure or hypertension. And this is a major problem. It is common across the country, but especially common among African Americans. And it's something that we really need to tackle. And it is an urgent problem. In fact, it's something that's become worse over the last few years. When we look at population statistics, the amount of people who have high blood pressure, it's actually getting worse in the last few years. And we need to start to make real changes if we hope to improve the health of the nation and each of our patients. We know high blood pressure is a major driver of cardiovascular disease, but there are little changes that happen in our daily life that can actually lead to more unhealthy decisions, lead to a more unhealthy life, and raise your blood pressure. Those include your diet, and particularly with food choices that are made and a lot of fast food choices that are very heavy in salt, but it's one that's especially faced within the African American community. Obesity and weight gain, as people gain weight, their blood pressure goes up. Smoking can have terrible effects on your blood vessels, but also make it more likely for you to have hypertension. What we call a sedentary life, people who don't get up and aren't too active. Being sedentary can lead to weight gain, but also on its own can lead to hypertension. And the final one is stress, and chronic stress, and the stress we face in our daily lives. And I think this is one that we believe to be uniquely prevalent amongst African Americans, that chronic stress of living on its own can promote hypertension. High blood pressure or hypertension can cause a whole host of problems. The big ones we think about are heart attacks and strokes, but can also cause other problems: kidney disease, heart failure, problems with your eyes. These are the types of things that can really prevent you from living a long and healthy life, and it's why it's so important to check your blood pressure and talk with your healthcare provider early to make sure your blood pressure is under control. Unfortunately, this is something that's been going on since the 1960s. We've known about this for a very long time. And that means it's on us to really start to make changes to help reduce our blood pressure and improve our health. I think it's one of the easiest things we can do is just check your blood pressure. Have your blood pressure checked, making sure you're seeing a doctor, a healthcare provider. Maybe you have a home monitor, something to check on your health status. If we want to continue to live long and healthy lives, these are the little changes we have to start to make really every day in order to improve our health.